Hi everyone. As a continuation of the lecture series on the International Day for the Disabled People, now we have Hiral Divyansh Mishra. Hiral has done her bachelor's in occupational therapy from Chem Hospital, Mumbai. She has done her master's in pediatric from Sion Hospital, Mumbai. She is certified in sensory integration therapy from University of Southern California. She has been working with the kids with special needs since more than a decade now. She is running an occupational therapy center named Rise and Shine since the last 6 years at Bangalore. She is trained in therapeutic listening program, handwriting without tears, Irlen Pass certification, brain gym, decoding autism, and many more related to the helping children with the special needs. So, with all these qualifications and experiences, she would be discussing the challenges involved in parenting a child with a vision impairment. Over to you, Hiral.
Yeah, thank you, Vidya ma'am. And thank you, Sankara Hospital, for this opportunity to share my learnings in this field. So thank you so much. I would be sharing my PPTs. Yeah. So yes, today we are going to discuss about parenting a child with visual impairment. And definitely I'm thankful to Sankara Academy of Vision for giving me this opportunity. The thing about parenting rule is there aren't any, and that what makes it so difficult. But beauty about this parenting is that you are the expert about your child. You know the best thing about your child. So yes, let's go ahead. When a child gets a diagnosis with low vision or a vision impairment, and parents goes with many stages, like emotional stages like worry, denial, fear, guilt, sadness, uh, sadness, helplessness, or depression, anger, and final stage comes the acceptance. And these various stages of emotions becomes their driving force to help the child in a better way. As once child gets the diagnosis, and as a parent, the stages of emotions and then the feeling of helplessness at the end, but the driving force about those stages and bringing and realizing that as like any child, this child also needs the same amount of love, affection, discipline, and learning. So what is very important as soon as any child borns, it is about how child and parents are connected to each other. That connection and attachment is very important. And how can we as a parent develop that? It is by engaging them in a daily caregiving, or kind of making an interaction in their daily life skills. And that is how it helps in developing the relationship between the child and a parent. And this is very important on a further development of their emotions, psychological development, and even their cognition developments. It is having a major impact in further development. So always emphasize on the connection with your child, attachment with your child, and get engaged in their engage the child in the daily life skills. And as we understand that child is having a diagnosis, and as any parent would feel that I may have to be I may need to interact with the child in a different way. Yes, there might be some amount of modification, But the research says that by Warren, the basic infant behaviors that elicit the caregiver's response, such as a smiling and vocalizing, does not depend on vision. So the way you interact with any child, the way your interaction as a parent with your infant with visual challenges. So you need to work the same way. And when the other research also supports that the vision is not required for infants to perceive the caregivers or parents' responsive behaviors, such as a vocalizing, cuddling, or feeding. So no matter what, you're cuddling to the child, you're talking to the child, the fun feeding time should not get compromised. Now, when we see about the development, yes, yeah, there would be some changes and variation in the development when child is visually impaired. But then how we can support and facilitate the regular development, normal development, by stimulating as vision is a challenge, then definitely we need to understand child's different other sensory systems like touch, that is a tactile, and auditory, what they hear. And if child is a partially blind, then definitely we also even have to stimulate the vision so that whatever vision is available, child can adapt to those vision and work efficiently. And while stimulating the child auditory wise or tactile wise, we really need to understand what is a child's interest, what activity child likes the most, and accordingly we need to adapt the activities. Like example, if child is if you take the child in the park and there is a slide, so definitely you need to give up a kind of auditory command or a kind of commentary that yes, now you are going to climb the steps, now you are going to slide. So this is how you can adapt the activity. And while working with the child, it is very, very important that we being a parent becomes a consistent in giving a command or kind of explaining the environment. The sameness, the consistency should be there. At times we as a parent becomes very, very, very impatient to get the things done from the child. So as soon as we give a command and then we expect the response immediately. But yes, we need to wait. Why? So as we give a command, child process it, interprets it, and accordingly they respond. And that's why always give a small command, consistent command, a very clear command. And it should be one command at a time. Give enough time for a child to process that information, and then you give another command. Okay, let your child know how he is doing. So example, the same example, while climbing the slide and the sliding, and if child is doing it, so at the end you kind of praise the process, you encourage the process, that I love the way you climbed on a slide independently, I love the way you were climbing the steps. So always encourage the process, kind of reinforce the process. And as a definitely there is a vision is a challenge. Child needs to understand what is exactly happening in the environment, because as a child learns from the environment, and how we can make them aware about it by giving a kind of explaining what exactly is happening around him, and that is how he's going to learn about the environment and have a perception about the environment. So always give a very clear instructions and commentary about the environment, what exactly is happening, who all are there, how does it look, what all colors are there. So be very clear and consistent about that information. And this is what is going to help further development. Definitely you can, if you see any major delay with their motor delays or any cognitive delays, please get in touch with the professionals like physiotherapists, vision therapists, occupational therapists, who are going to help you to help your child in a better way. And whenever, whatever is a child's strength, how much ever child is able to do it on their own, encourage child to be more independent, age appropriately independent. So example, by age of 1, they start having the finger food on their own. So it's the same way, age appropriately, you should be encouraging the independence in all the areas like eating, dressing, bathing, toileting, age appropriately. And definitely even the interacting communication, even in the household things, encourage child to be more independent, engage them. And this is how they are going to learn about the environment. This is how they are going to learn about their own body. And this is what where we need to really look for, that is the independence in their life skills. Very important point at times where we really need to focus is about the safety. That is like in the home environment, or where the child is spending most of the time, that environment should be safe for the child to move around. So how do we make sure that child is safe? So make sure that all the furniture corners are not rounded. You cover the sharp corners and try to keep the furniture at the same place, which is very, very important. You should not be moving the uh, location of the furniture so often. It should be in the same place so that child learns the permanence, like, and that's how that it's going to help them for a mobility. And then help the child identify the danger. So you can make a cues like this. So this is a mat which you can, so this is just an example to make you aware about how you can work on safety. So example, there is a stuff close by to this place. So you can few steps before that, you can place this type of mat, which is having some amount of tactile feel. And then you can first explain the child that this is the mark. From beyond this point, you should not be going forward. First you explain, and this explanation needs to be done again and again. It's not at times just one time you have said and then child will assume that. No matter what, for safety rules, it's always we need to again and again, we need to keep talking to the kids. You need to read books about the safety. So that's how you can reinforce and make sure that child understands what is safety and what is danger. And this is how you can work. This is just one example about it. Now, as we have our own occupation, everybody has their own profession, occupation. That way, do you understand what is do you know what is a child's occupation? So it's not study, it's not academics, it's just a play. Imagine, kids should be playing throughout the day, ideally. Okay, and that is how they are going to learn about the environment. That is going to help them develop their cognition, emotional regulation. All these things happens, they develop their fine motor, gross motor, their strength, and all the things comes with the play. And this is where we should be focusing more about them. And as yes, there are challenges with the vision, so definitely we need to adapt few things. So we need to have more auditory and the tactile based toys or books, and that is going to help the kids to learn about, and they are going to manipulate different things, and they are going to work on all the different areas which we discussed just now. So yes, it is very, very important part of the every child, and we have to make sure that every child gets a good amount of playtime throughout the day. And yes, we should have a regular play dates where they learn from each other. So make sure that child is having a good amount of play throughout the day, and they once in a while, or depending on the availability, you can have a play dates for them. And this is how they are going to learn about the different things and then they are going to even learn about the reality of the world, where they learn about the bargaining, and it's very, very important integral part for their further development. So my take home message for the parents are, as you can't pour from an empty cup. So you really need to take care of yourself first. And yes, as a parent, it is definitely challenging for everyone. So we really need to be we really need to be very realistic about our child, about their strength and goals. Definitely, we really need to take care of ourselves so that we can give the best things for our kids and our family. You really need to talk to your other family members so they can help you with that. They can support you emotionally, or they also kind of help you with helping with your child. And yes, do not hesitate do not be so hesitant about asking for others help, which is very very important. As we say, to raise a child we need a village. So this is how we really need to be. And definitely there are different support groups which may help you to understand and which may help you to kind of help your child in a better way. Or at times it definitely helps for a parent for their own emotions and kind of understanding what possibilities are available and what our resources are available from the other parents. And that is how we can help our child. So yes, thank you so much. Thank you.
Thank you, Hiral, for that wonderful tips for parenting these special children with the visual impairment
Thank you, ma'am.
in the process of making them more independent. Probably all these might make their life more easier. Thank you
Yes.
so much.
Thank you, ma'am. Thank you so
Thank
much.
you.
Thank you.